Dr. Ranjan is speaking on artificial intelligence in glaucoma.
Good afternoon, all of you, and welcome to the first midterm conference on behalf of local organizing committee. This is a very interesting topic, and even I am in the phase of learning this topic and trying to understand as what artificial intelligence can do in the diagnosis of glaucoma. So, so uh, primary open-angle glaucoma is the most common subset of glaucoma, with 53 million cases worldwide. And we do not have strategies as to really diagnose accurately whether it is a glaucoma or a non-glaucoma case, especially in the early cases. Tools that are disposal are shown in the picture. These are used for making a diagnosis of glaucoma. So optic nerve is like a telephone connection between the eye and the brain. They see in the picture here, a diagrammatic representation. Artificial intelligence is being used primarily in diabetic retinopathy, glaucoma, age-related macular degeneration, and IOL power calculation, apart from other eye diseases as well. Why this is important is because early glaucoma is typically asymptomatic, and like for example, uh, detection depends on clinical examination. For example, patients of macular degeneration, they can present early, whereas early glaucoma patients do not present early. They present only when the disease has progressed to a fairly larger extent. And progression can be subtle and can be difficult to appreciate in the initial stages. The reality in Indian scenario, rather global scenario, is that with more patient time and less chair time, one needs a high priority checklist to ensure nothing important is overlooked. With approximately around 90% rural and 50% urban population remaining undiagnosed, there is a need for a robust and a fast, accurate screening methodology, and artificial intelligence as such fits the role here. Role of artificial intelligence is in screening, early detection, diagnosis, classification of glaucoma, quantifying risk factors, and progression. And this is done by automated processing of large pool of data, which can be done by artificial intelligence. And why we have picked up a glaucoma for artificial intelligence is because of the fact that glaucoma is a mystery disease. Many of the variables in glaucoma do not have a definite cutoff line, like the intraocular pressure or the optic nerve changes, the RNFL, the ganglion cell layer, etc., etc. Family history and systemic diseases also influence glaucoma, so diagnosis requires to incorporate all the borderline cases to start early treatment and predict a course of the disease. So all these have to be integrated to come to a final conclusion. Some of the basic definitions of that we come across in artificial intelligence is that uh, what is an artificial intelligence? It is a science of applying computer algorithms to replicate intelligent human behavior. We have machine learning, is the capacity of the computer to learn from experience, to modify its processing based on newly acquired information on its own. Neural network, a software is built as a network of neurons communicating with each other with multiple inputs, modifying the output with a feedback loop of learning. And deep learning is a class of machine learning algorithms that uses multiple layers to progressively extract higher level of features from the raw input. For example, an image processing, the lower level layers may identify the edges, while the higher levels may identify the concept relevant to humans, such as digits or letters or the elevation of the faces. So it is a kind of advanced level of neural network. Coming to the basic factors which we take into consideration for glaucoma diagnosis, the intraocular pressure, the IOP trends from previous data and medication are useful for artificial intelligence. In one study, artificial intelligence was used to evaluate a large pool of data using a seismoid triggerfish. And, uh, and Martin et al. Used this data from 24 prospective studies of triggerfish using random forest modeling, a machine learning method to identify the parameters associated with glaucoma patients. Why this was relevant is that when we see the office intraocular pressure reading, fluctuation and the 24-hour fluctuation, we find that with the office time intraocular pressure fluctuation, we see the blue line, which is marginally, not only marginally, but substantially lower than what fluctuation we get in the 24-hour period. So with this, what can be done with the artificial intelligence is that we can pick up 2 points, and with large pool of data that can be compared, and then we can really find out what kind of fluctuation the eye can have in 24 hours time. Optic disc photograph is another important factor, and there are and a lot of studies have evaluated that it has got a high sensitivity and approximately 95.6% and specificity of 92% for glaucoma detection. There are various studies that have been done, and how that is done is that a large pool of data, a fundus photograph, they are labeled as glaucoma and non-glaucoma by experts, develop a computer algorithm and which can be better than the actual human examination. The picture is shown here in the bottom, how this is done. So what the eyes see basically is an image, is a picture in a color picture. Whereas what does the fundus imaging of the computer does? It breaks it down, segments it into numericals and pixels. And these large number of pixels, they are accumulated with a large pool of data, and whenever a new patient comes and the fundus photograph is captured, they are also converted into numericals, and these numericals are compared with the normative data or the disease data, and as per that, a result is given for a final analysis. So there are a few examples like CALF Innovations released retinal image analysis, glaucoma cloud-based software in 2016 to analyze the fundus images. Can you just one? Okay. Coming to the OCT and OCT findings, the OCT automatically measures the disc size, cupping, neuroretinal rim area, and RNFL thickness and the GSL thickness by using artificial intelligence, the image processing techniques known as segmentation. Mohammed et al. Has shown that a hybrid deep learning method on a single wide field swept source OCT has 93% sensitivity in detecting glaucoma suspects. Ashoka et al. Has evaluated a deep learning algorithm with a pre-training that diagnosed glaucoma based on macular OCT for RNFL and GCL. Likewise, for anterior segment also, we have algorithms which can analyze and depict whether the patient has got the kind of angle closure the patient can have. Visual field, a lot of research has been put into visual fields. It has a rapid and an accurate interpretation. There are a lot of studies which have been done. And I'll just go into one of the most important which I found is that the fields do not quantify the nature of regional field loss, and summary indices is limited to overview only. So we need more information on early detection and management of glaucoma. And this archetype analysis was developed by Tobias Elias from Harvard. He provides an objective and quantitative information on the regional field loss. And what he found was a 14 type of field patterns that was seen in 2045 eyes, studied over a period of 25 years. And what he found, the most interesting that he found was in this field which had an early central field loss. And this is characterized, and this kind of a field loss was characterized by a rapid progression. So these kind of feedback from the previous studies put into artificial intelligence can really be helpful in aggressive treatment and management of glaucoma patients. Predicting prognosis is also important, and Yosef et al. Showed that the machine learning detects visual field progression consistently with slow progresses. It works on portable perimetry devices, and all these can be helpful guide for customized target intraocular pressure. So future prospects, algorithms are always getting better. We expect in future to have an artificial intelligence with an extremely good sensitivity and specificity to surpass human ophthalmologists. Combining various glaucoma evaluation can achieve a near perfect diagnosis and prognosis. What is desirable is a single test that can extrapolate and predict the other using artificial intelligence. For example,
Please
an
wind up, Dr.
OCT
Pranav.
predicting visual field by extrapolation. So these are the 6 pearls which we have to
Yeah.
keep in
Yeah, please wind up.
understand. Yeah. And the future incorporation of artificial intelligence into healthcare models may help address the current limitation of access of timely management of patients with glaucoma all across the world. Thank you so much for your kind
Thank you, Dr.
invitation.
Pranav. I think
Yeah.
you have given us details of where the AI can help in glaucoma diagnosis and management. I think this is a very emerging field and still not very well understood by most of us. But in future, I think this is going to play more and more role, especially when you have enough data, because AI is data driven basically, and so once we have more and more data with us, digitized data probably will get better at it also. The computers will become better at it, and we'll also become better at it, what the computers are telling it. But I think there's a bit of mystery in AI as far as we are concerned, the way we understand it. But it is going to definitely, AI is
So
going to play
what
a
I
more
think
role.
is the best
Yeah.
part of it is that if you have a software in which you can put in just 4 or 5 data and which can really predict, I mean that can give a clinician a high level of suspicion that whether the patient has a glaucoma or not. So that is one of the
I think
the
that's
best
one
part. I
of
mean
the
you
ways
cannot
that
100% depend on the artificial
Yeah.
intelligence, but putting in all the data and then trying to correlate with your own clinical finding, that can really justify as to whether treatment has to be started and how you have to
Yeah,
manage the
but
payment.
the problem is that the clinical finding themselves are quite noisy. When the noisy means that there's no agreement actually between, even in a given situation, in a given patient, even among the experts, we have 100 experts. 100 experts, they will have 100 different views of the same patient, and that's where actually the artificial intelligence may actually score at some point of time better than human beings, because all the situation where the data is noisy or when the decision making is noisy, I think to reduce that noise, I think AI perhaps may be a little better option. And glaucoma is one such area where there's a lot of inter-individual, inter-expert disagreement, I would say, is quite high in glaucoma. And that's where the AI could perhaps help us.
Great.
Thank you very much. I
Thank
think
you,
it's a
sir.
very exciting field. We need to watch it and learn know more and more.